care facility places. So we knew that our residents, and particularly our more vulnerable residents, needed to be our top priority. And that is what we focused on throughout this pandemic. We are currently working with Virtua and the state to operate our vaccine mega site here in Morristown, New Jersey. More than 200,000 people have already received their vaccines there. So we have a lot of things going on to continue our protection, our information about this pandemic. So tonight's discussion is just one of the additional layers that we're offering to our residents so we can continue to keep folks informed. So I am looking forward to hear more about what we're going to be able to do for our residents in the future. I'd like to now turn things over to our moderator, Joanne Weiner. Joanne will introduce our panelists. Thank you so much, Joanne.
Thank you, Director. I'm excited to do this today. I think we have a great topic. We have a few doctors here with us today. I'm going to read a little bit about each of the doctors. Each physician has a different background. It's quite interesting. Our physician, Dr. Trivedi, will be joining us. Dr. Trivedi of infectious diseases at AtlantiCare Regional Medical Center, which is part of AtlantiCare. In his role, he oversees the hospital's response and activities related to infectious diseases. Trivedi is a key member of the AtlantiCare's COVID-19 preparedness and response team. He also serves as co-chair of AtlantiCare's antimicrobial management, antibiotic stewardship, and infection prevention committees. He has served as a physician lead in AtlantiCare's Ebola preparedness team in 2014. Dr. Trivedi has done extensive research on infectious and emerging viruses and pathogens, including severe acute respiratory syndrome, SARS, anthrax, and Ebola. He's lectured nationally, regionally, and locally more than 200 times on infectious disease-related issues. He's a board-certified infectious disease specialist. We also have with us tonight Dr. Cucuzzella. Dr. Cucuzzella is the health officer for the Burlington County Health Department, serving the 40 municipalities of Burlington County. She has worked for Burlington County Health Department for the last 19 years. In this role, she guides all of the public health programs, including communicable disease investigations, food inspections, and air and water pollution programs, the WIC program, and the Burlington County Animal Shelter. Most of her time these days, though, is spent on the county's COVID response. Dr. Cucuzzella has experience working as a health educator, risk communicator, epidemiologist, and clinical research coordinator. Her previous employments include the Massachusetts Department of Health, Public Health, and the McGuire Veterans Medical Center in Richmond, Virginia. Also joining us this evening is Dr. Zupenda Davis-Shine. Dr. Shine is the Director of Health Education at the Burlington County Health Department. In this role, she supervises all health education and promotion activities and events for Burlington County, New Jersey. She plays an integral part in the health department's COVID-19 response by disseminating public health messages focused on prevention, testing, and the vaccine. She also serves as the county's health educator, risk communicator. So we have quite a panel of folks that are very knowledgeable in our topics this evening. And so we're very excited to get started. And so what we're going to do is we're going to ask each of our physicians in their turn a series of questions. I'm going to ask them one at a time, and what I'd like to do is monitor the chat box, and if we have a follow-up question that happens to be in the chat, we'll ask the physician that question. The rest of the chat box questions will hold until the end, and we will try to answer all of the questions. And to the panelists, at the end, when we're asking the chat box question that any of you can answer, please be comfortable answering whatever one you would like to. Any questions we cannot get to, we will put a link in the chat box so that you can email us the question and we will respond to you that way. So let's begin with Dr. Trivedi. Hi, Dr. Trivedi.
Hi, thank you for having me.
Thank you very, very much for being with us.
Of course.
Most vaccines take several years to create, test, and approve. This vaccine, though, seems to have been created quickly. So is it safe? And certainly, is it safe for pregnant women to get?
Sure. So, I've been getting this question a lot about these novel vaccines. The technology for these vaccines has been around there for quite some time. We were using this technology to fight off certain types of cancers. What we ended up doing is modifying some of that technology to use it as a vaccine, and I think that's the novel approach to this. How it's streamlined so quickly. Usually, vaccines take quite some time to produce. There's a lot of bureaucracy and red tape to go through with research and proposals and moving back and forth. All of that was the red tape was cut away for this process, and it really streamlined the efforts of everybody. Plus, there's a lot of money being used for research for this, and that's kind of expedited the production of these vaccines. So the fear that, oh, this is too new and we don't have enough information, I think should be alleviated by the fact that the whole world, not only the country, but the whole world has been pushing behind these vaccines to make this move very quickly. And I think that's what the end results are, these fantastic vaccines. As far as it being efficacious or safe in pregnancy, right now, all of the OBGYN kind of leads in the country are all recommending to get the vaccine. We don't have enough information as far as how this vaccine will kind of play out, but we do know that people who've had COVID go on to have successful pregnancies and go on to have successful births and deliveries. And so we know that those natural antibodies don't cause any real issues with babies. We also know that pregnant females oftentimes suffer the most when they get COVID. They have a lot of severe illnesses, and their illnesses progress very quickly. And so the benefits of this vaccine far outweigh any of those concerns.
Thank you.
Sure.
Dr. Cucuzzella, you'll be up next, please. Can you get a vaccine if you currently have COVID-19? And how long do you have to wait after you have COVID before getting a vaccine?
So initially there was a lot of information about this suggesting individuals postpone or wait to get vaccinated if they recently had COVID. And some of that came about because in the beginning the vaccines were so limited, and we know that people that have had COVID have some level of protection for they think about 90 days after their most recent infection. But as the vaccine has become more available, there really is no contraindication for somebody that has had COVID to prevent them from getting vaccinated. We do want individuals that are COVID positive to wait till they are not sick anymore, till they're out of their isolation period, because we don't want them being sick and going into a large vaccine center. So once they are out of their isolation period and they're feeling better, then they are welcome to get vaccinated at any point in time after that. We do have individuals that get their first dose and then test positive in between their first dose and their second dose. And the same applies in that situation as well, that we would want them to be out of their isolation period, feeling better before they go on and get that second dose.
Thank you.
Welcome.
Dr. Shine, may I ask you a question next?
Sure.
Who do you recommend people ask about their COVID-19 vaccine questions and concerns?
Well, there's a couple of answers for that. So one thing I do want to point out is that there are a lot of resources that are online, and I could put these resources in the chat, but there is a lot of user-friendly information on the CDC's website. They have FAQs, so frequently asked questions there. They even have a section on myths versus facts. The New Jersey Department of Health has resources, and the Burlington County Health Department as well. You can find information on the health department's Facebook page, both the state and the county level. But in terms of asking someone questions, I would recommend that people talk to their primary care physicians, or if, let's say that someone has a history of allergies, to have that conversation with their allergist. Or if the individual is seeing a specialty care physician, I would talk to them about any concerns that they may have regarding getting the vaccine. One thing I will say is that for individuals who may be seeing a specialist, they are more than likely at a higher risk for getting COVID. So it is recommended that they do get the vaccine. But I do understand that there are, some people that, it can be a lot of information online, and reading it can be a little bit taxing at times. So there's multiple ways to get the information, but I think having those conversations with their primary care physicians and other individuals who they trust that have this reputable information is a good way to go to get those questions answered and those concerns addressed.
Thank you. Dr. Trivedi, starting at what age can you get the vaccine? When do you anticipate a vaccine for kids?
Yeah, so we know that there are 3 types of vaccines right now, 2 of which are 18 and above. There's one that's 16. So Moderna and Johnson & Johnson, the studies were all done for people 18 and above. Pfizer did their studies with 16 years and above as well. We know that both Moderna, Pfizer, and Johnson & Johnson are currently enrolling children ages 12 and up into a vaccine trial. They have very promising data right now, and they actually submitted that to the CDC as well as the NIH, as well as the FDA to try to get expedited approval. We anticipate those vaccines to be approved and ready to go, hopefully by the beginning of the summer is the anticipation, within the next several weeks at most.
Thank you. Dr. Cucuzzella, what are your organization's plans to take the vaccine into local communities to make it more accessible?
So the good news is that as we move further into the vaccine campaign, vaccine is becoming more available, more places, and more people are able to get vaccinated. We are hoping that over the next couple of weeks, we continue to see an increase in vaccines coming into New Jersey. When that happens, and the health department has a good supply, steady supply coming in, we will go into the community and conduct community-based clinics to where individuals are. Right now in Burlington County, we do have the mega site that Commissioner Hopson spoke about. We also have a number of pharmacies around the county and our federally qualified healthcare center vaccinating as well. The health department right now is focusing on some special populations. We're focusing on homebound individuals, those with homeless, incarcerated, so those in very specific settings that we're focusing on. Once we get more vaccine, we'll work with different communities to bring it out to individuals that just don't have the capability to get transportation to the mega site or aren't comfortable going to the mega site, that they're more comfortable getting it in their house of worship, in their local community center, in their senior center. So we're going to be working with those organizations around the county to make sure that we provide vaccine where people are comfortable receiving it.
Dr. Shine, what are the common side effects of the vaccines?
So the common side effects of the vaccine would be some soreness at the injection site. There may be some pain there, some redness, and maybe some swelling. So one way to help with that is to apply a cool, wet washcloth on that area. And the arm can get pretty sore. So even though it may be sore doing so, it is helpful to use or exercise that arm. Other side effects can be body aches, chills, fevers, headache, nausea, and just being really tired. One thing that the CDC has developed is after vaccination health checker. Is called vSafe. And so you would register for that. And the website, and I can put this in the chat as well, is vsafe.cdc.gov. And what it does is it sends you a text message for you to report every day for the first week after getting your first dose, and then every week for the next 6 weeks. It'll allow you to, it will check in to see how are you feeling. You will report any symptoms that you may have. And then let's say in the event that someone does have, I don't know, fever for a good number of days, it may text you back and say, please call 911 or call, your doctor, because after a couple of days, your side effects should be waning off. So it's a good way for the CDC to collect data from individuals who have received the first dose, if they have Pfizer or Moderna, or also data after getting the J&J shot. And it also gives a reminder for to schedule your second shot if that has not done. But those are pretty much the most common side effects. And it varies. It could be experienced a couple hours after they're getting the shot or the next day and can last a day or two.
And thank you for the links that you put into the chat box for us. Thank you. I think that we have Dr. Conaway joining us now. And Dr. Conaway, are you with us? Let's give him another moment to get in. But I do want to make sure I thank you again for all the links that you listed for us in the chat box, Dr. Shine. That was great.
Yes, I'm on by phone. The computer at the office didn't work for whatever reason. I'm not able to launch the executable file to get this thing working. So I'm on by phone. I thank you for this presentation. I'll be glad to answer any questions that you may have.
Well, thank you so much for doing that. Can I give you a little introduction, Dr. Conaway?
That'd be fine.
Okay. This is Assemblyman Dr. Herb Conaway. The Honorable Herb Conaway is elected for the 12th term, serving New Jersey's 7th Legislative District as its Assemblyman for 23 years. In the 219th legislature, Conaway is a leader in the Democratic majority. Chairman of the Health and Senior Services Committee, member of the Appropriations Committee, and member of the Science and Technology Committee. We are thrilled to have you. And what I'm going to do is ask you a question, then I'm going to start the rotation again, and I'll include you into that rotation. So, Dr. Conaway, if you're fully vaccinated, are you allowed to be around people with one or no vaccine and not from your household?
You can attend the houses or small gatherings of people who are not in your household if you're fully vaccinated. Again, they should be small gatherings, and they should not contain those houses that you visit. Persons or individuals in them that are at high risk. So if you're visiting the home of somebody, let's say, who's has a severe pulmonary condition or other things which might negatively impact their immune system, you should, for their sake, not visit with them. But outside of that, as long as the group remains small, about 10 persons, if you're vaccinated, you can visit indoors with people who are not vaccinated.
Thank you, Dr. Conaway. We're going to begin the panelist rotation once again. I'll start at the top and I'll put you into the second position.
Okay, great.
Thank you. Dr. Trivedi, are the current vaccinations effective against known variants?
That's a great question. There's a lot of research being done right now against some of the known variants. We do know that the UK strain and the mRNA vaccines have shown really good efficacy against each other. And so what do I mean by that? The mRNA Pfizer or the Moderna vaccine seems to have good efficacy in protecting you against the UK strain. Just recently, the South African strain has shown to be able to be overcome by the Pfizer vaccine. Moderna's research is coming up right now and showing similar efficacy. Not that it completely prevents it from occurring for the South African strain, but it does prevent severe illness, which is the key for any of these vaccines. We know that with J&J as well, severe illness is prevented. So it does an excellent job. As far as will you need to get a booster, there is some concerns about a booster moving forward, and it's really to incorporate the other strains. All of these mutations that occur, these boosters will kind of be like an add-on to the vaccine you already have to create more spike proteins so that it prevents any infections from all of those strains.
Well, Dr. Conaway, can we follow up a little bit on that booster? And can we think about how long the benefits of the vaccination will be effective?
Well, Pfizer has put forward some data that would suggest that the immunity this post-vaccination immunity with the Pfizer vaccine will last for 6 months. The hope is that we know that studies are ongoing with the other vaccines and that hopefully they'll show similar findings at least. And the hope is as we have more data or collect more data from those who are vaccinated, we'll find that the immunity lasts hopefully much longer than 6 months. But that remains to be seen.
Thank you. Dr. Cucuzzella, what does community spread mean?
So community spread is when we see, people infected out in our county, municipality, around the state, who sometimes they don't know where they got the infection. And that's usually when we start to get concerned, is when things are spreading and we don't know where individuals are being exposed. But the good thing about understanding community spread is that we know that quarantine and isolation work, which is why those two words have, are used so often when we talk about COVID, because it allows us to stop community spread. Because when we know somebody's been exposed to COVID and we ask them to quarantine, it's because the hopes of, by the time they're in quarantine, if they do end up getting sick, that would not have exposed anybody to COVID. So that way we can contain that spread. So instead of one person getting sick and infecting two others and those two others, and it grows exponentially, if we ask somebody to quarantine, stay home and not have contact with anybody, then we can stop that individual from spreading the disease. And so that's why it's still important for people to isolate and quarantine. Isolation is when you're actually sick with COVID. We need you to isolate away from everyone. Quarantine is when you've been exposed, and we're trying to prevent you from getting sick and expose other people. And those two things are really paramount still in helping us to control the spread.
Dr. Shine, how does COVID-19 impact women in particular? And are women automatically more susceptible?
Well, it's real interesting when you are comparing just overall in general, men versus women when it comes to COVID. There's not much differences there. But as you start to look at Black women, you see that the mortality rates for Black women in the United States are about 3 times that of white and Asian men, and that Black women in the United States are dying from COVID at a higher rate than any other group, male or female, except for Black men. One of the factors that studies are looking at is that the essential workers, many Black women have the role of working as an essential worker, which will increase their risk for COVID, So they may more likely have jobs as nursing home assistants or home health aides. Those positions are disproportionately held by female minorities. One of the things that's how COVID has impacted Black women, women particularly, is when you're looking at the economics of it, and that many of the women they have lost their job due to the pandemic, either being downsized or maybe they felt like they did not feel safe at their workplace, or there were different school closures. So if they had children at home, they had to then increase their work obligations at home and then also their childcare obligations in the home. So there's a large increase of stress that's related to that, and an increase of home and work responsibilities. And, also you have many women that may be without pay because they now have these duties at home because of these responsibilities. There's also studies showing that women have higher rates of anxiety and depressive disorder more than men. Women with children women with children are more likely to report symptoms of anxiety and depression than men with children. And these numbers are the same prior to and during the pandemic. So there's differences when you start to look at race and look at social inequalities and how racism plays a role in terms of COVID. The other part, I'm sorry, I didn't want to forget too, is that there's also an increase of domestic violence with the pandemic being here, because women, a lot of them, their saving grace is leaving home away from their abuser and going into work. So if now they're working in the home, they're spending more time with that abuser. So we have seen an increase in domestic violence rates regarding that. And this is not just women in heterosexual relationships, this is also in same-sex relationships as well. So the pandemic impacts women in different ways, not just in terms of health, but economic wise, socially, and so forth.
Thank you. Dr. Trivedi, now that summer is approaching, how can we socially distance and break the fatigue experienced by our children? Can they go swimming? Can they play with friends without masks?
Yeah, so now that summer is approaching and we're starting to get nicer weather, I think being outdoors will help kind of alleviate a lot of the quarantining and a lot of the isolations that people have had to go through during the winter time. I think outdoor activities, from picnics to being outdoors with friends, of course, is a great way to socially interact. As far as children going swimming and such, you can certainly go swimming in an outdoor kind of situation, playing without masks as well. You really want to monitor your symptoms of your children. You don't want to send them out if they're having fevers, flu-like symptoms, body aches, anything like that where they could potentially have contracted the infection. But being outdoors, of course, is going to be a great relief for our community specifically, just because we can start to interact, start to feel somewhat normal again. So I do anticipate that to be a great thing for us.
Dr. Conaway, when will it really be safe for us to go to work and travel?
Well, there have been some changes in the guidelines on travel, but I must say, with respect to the government has yet to make final decisions on what access rights will be, for instance, for pools and other things, fairs, parades, and the like. So there are some provisos there with respect to that. Outdoors activities are certainly safer than indoor ones, but in terms of the of events involving other people around pools and the like, we're waiting for guidance from the Department of Health on that. Now, with respect to travel, guidelines have changed that will allow those who are traveling domestically, that is within the confines of the United States, if they are vaccinated, to be able to travel without either getting a test before travel or getting a test when you arrive at home from travel, or going into quarantine after returning from travel. And so this is quite a difference now than what it was just a couple of weeks ago. And even with respect to international travel, unless the country that you're visiting requires you to test before entering that country, if you're vaccinated, you don't need to get a test before you go to that country. Now, if you're coming back to the United States from an international arena, you're going to need to get tested upon entry. And if you have either with a negative test or show that if you happen to get COVID overseas, that you are now negative before you come back. But even those persons are not required to go into quarantine when they come home from international travel. Now, your employer may have something else to say about that, but if you're vaccinated, the travel requirements are quite more relaxed, much more relaxed than they were just a couple of weeks ago.
Dr. Cucuzzella, is there any support for families dealing with housing or food insecurities due to job loss caused by COVID-19?
So the county does have a lot of different programs, and we can look at it as in kind of two different ways. The first of which is individuals that are COVID positive or are living with somebody that's COVID positive and need to isolate or quarantine. We do have assistance for them. We actually have somebody on staff that's called a social support coordinator, and they are specifically working with individuals that might need food because they've had to isolate and quarantine and they can't get out to get food, or because they haven't been able to work, are now food insecure. So when our contact tracers and our case investigators reach out to these families, they find out what the needs are, and that's relayed to this staff member, who then arranges food deliveries for those individuals, connects them to maybe unemployment services, heating, and electric programs that are available for them as well. So it really tries to help them through their isolation and quarantine to make sure they stay in isolation and quarantine. And then there are a lot of other programs now available through the Human Services Department that can assist people with some of the unemployment issues and housing issues that have arisen because of COVID.
Dr. Shine, what is herd immunity?
So herd immunity is when there's enough people in the community that are protected from getting the disease because either they've already had the disease or have been vaccinated. With herd immunity, it makes it harder for the disease to spread from person to person. And it can even protect people who have not been vaccinated, like newborns, for example. But when you're looking at herd immunity, it can be achieved in two ways. The first way is natural infection, which is someone being infected with COVID. So one thing about COVID, we all know about the consequences of getting that. So if let's say we're looking to do herd immunity through natural infection, that wouldn't be effective because of the harshness of it in terms of the death rates and the sickness and all of that that comes with that. So it's recommended that we aim to get this herd immunity through the vaccine. With the vaccines, we've seen herd immunity through different things, such as, polio, rubella, those types of things. Also with the natural immunity, we know that we don't know how long that person is going to be able to have those antibodies. I mean, we've been hearing about, about the 90 days. With the vaccine, even though we're still studying how long that protection lasts, we know that it is greater than the 90 days. So that is why we are aiming for the herd immunity to be done or reached by the vaccination. One thing to make sure too is that if someone is getting Moderna or Pfizer, that they need to make sure that they get their second dose so that they can be completely protected.
Can I ask a follow-up to that?
Sure.
So if a group of people don't want to get the vaccination, will they prevent herd immunity or will they benefit from the rest of us that do get the vaccination? Is that a hard question?
No, that's a good question. And I mean, and I don't know if Dr. Cucuzzella wants to chime in on this answer, but I mean, people in general benefit from it, but I mean, because there are some, we have to face it that there are some individuals who will decide that they're not going to get the vaccine. But what our hope is that the majority do get the vaccine. So that will benefit everyone because there are going to be more people vaccinated. And I don't know if anybody wants to add any more to that.
Well, look, we know that there are people in the community that will not get vaccinated. But I can tell you that if you're working, let me back up for just a moment. I think first of all, we want to call it community protection. I think we need there's sort of a marketing issue that we want to be thinking about with respect to the vaccination status of a population. If you listen to the CDC and experts there, I've heard numbers from as low as 70% to as high as 85% of persons should be vaccinated in order to achieve community immunity, community protection. We know there are individuals who, for various reasons, cannot be vaccinated, and that the vaccination status, the positive vaccination status of others, helps, in particular, those people who are unable to get vaccinated because they have particular challenges with their physical health. And quite frankly, it's one of these. I always say that how much do you care about what goes on with the society at large and where we are in our economy? There are always people who sort of want a free ride on this issue, but many others understand it's important for their own health, that's important for the health of their loved ones and their family, and have concern about the larger society and the need to protect individuals from this disease and from death from this disease, and to actually make sure that we have an economy that flourishes because we don't have wide-ranging high rates of infection with this disease or the other diseases, which can cause serious dislocation for individuals, for communities, and indeed for our nation.
Dr. Conaway, may I stay with you for a moment, please?
Sure.
Some people, because you touched on something, some people are postponing surgeries because they're afraid of catching COVID at the hospital. Are the hospitals safe? And should we be taking more precautions than we're taking now?
Hospitals are safe. The hospitals are, depending on the procedure that you need to get done, whether how invasive it is, how close quarters you'll need to be, hospitals are taking precautions, and people should feel safe. One of the things we found, particularly in the early stages of this disease, before we developed the protocols that have allowed us to achieve, very high rates of survival after having COVID, and understanding how to, protect hospital workers, protect people going in, getting testing done, that people were afraid to go to the hospital. And a lot of people, unfortunately, were succumbing to illnesses that they would not have succumbed to if they had gone to the hospital. People who were sitting home with chest pain, who were afraid to go and ended up dying at home of a heart attack, or having other chronic conditions that spun out of control because they were afraid to go to the hospital, afraid to go see the doctor. And so what I would say to people is that they can be very confident that they are safe and pursuing their care needs in the hospital, in the doctor's office, and hopefully their self-care needs at home.
Thank you. I would like to call this to a close with one question to each of you. If you would please indulge me, if I go to each of you and ask you if you could give us listeners one bit of advice about the entire pandemic period. That's a big question, but it encompasses, I'm sure, a lot. But if there's one salient point, one little golden nugget you could give us. I'll start in the rotation once again. I sometimes think that one golden nugget, I come away from meetings sometimes with just that one thing that I say, boy, I can really hang my hat on that. Dr. Trivedi, what do you think would be the one thing you would tell all of us listeners today?
I think the really one important thing is that we all are trying to do our best for ourselves, but as well as our communities and each other. And I think it's really important to continue to do everything that we've been doing to try to overcome this pandemic, not just for ourselves, but for our neighbors, for our families, for our loved ones. And that includes the physical distancing that we've all been doing and maintaining, wearing masks when appropriate. And of course, the vaccine itself, that's just another tool for us to use in hopes of overcoming this. Not all of us are active participants in taking care of COVID patients, but it's a way for all of us to be involved in overcoming the pandemic together.
Oh, thank you. It's funny. I think we all learned as citizens over time that we're not just helping ourselves, that we're helping others. And now that we're just beginning to kind of understand that. So that's a really great thing for us to take away with. Dr. Conaway, what about you?
Well, I would say that people should understand that the vaccine is safe and effective. If you want to prevent yourself from dying or having serious illness in the hospital from COVID, your best bet is to get vaccinated. And I would say, too, that as we move to this period of vaccination, as people have become understandably fatigued with fighting this terrible pandemic, not to continue to bear down, to remember that we're not there yet, and that we have to, as tired and fatigued as people are, and as fed up with this virus as people are, we just have to finish the race. We're just not done yet. And so we've got to continue to drive forward. We've got to continue to encourage vaccinations among the public. And even those who are vaccinated, you have to continue to wear your mask. You have to continue to wash your hands frequently. And you should be careful about your involvement with large groups of people, many of whom may not be vaccinated. Because if we don't take those steps, if we don't go the extra mile, if we don't finish the race, we're going to be dealing with this pandemic a lot longer than any of us want to.
Thank you, Dr. Conaway. Dr. Cucuzzella, how about you? Would you give us your best advice about all of this?
Sure. I will say that both Dr. Trivedi and Dr. Conaway both took both things that I was going to say, because it really is not about you when it comes to COVID. Yes, it's about protecting you, but it's about protecting those loved ones, which is why even fully vaccinated, you will see me in a mask all the time, outside, not inside. But I will say there is so much misinformation out there, and social media really leads to a lot of misinformation. And, well, I heard that this person did this and this happened and this. Go to your trusted sources. Zupenda gave a great list of, resources that are out there, and she posted them in the chat. Make sure that when you're making decisions and deciding what activities you can engage in and whether or not you're going to get vaccinated, go to those trusted sources and become educated on those topics. and reach out to your primary care provider, reach out to the health department, and get the answers that you need, and don't rely on social media for those answers.
That's good, because I think that a lot of that is so confusing to those of us that don't do this kind of thing for, we just don't know. And I think those are great references, and I'm definitely going to rely on those. Dr. Shine, can you bring us home? Give us some great feedback and ideas.
No fair. They took all my answers. I would
Well,
say.
can I ask you another question? Why is it that why is it I see people all go to a restaurant and they say, but it's okay, we can take our masks off inside, we're eating. Is it really okay?
So the guidelines basically state that if you are well, let me backtrack. It's safer to be outdoors than indoors. And basically when you are eating, that is the one time that you're not wearing your mask, because you can't eat with your mask on. So the guidelines will indicate that if you are at a restaurant, that you can, you have to wear your mask any other time you're not eating. Like when you come in, you have to have your mask on. If you get up to go to the restroom, you have to have your mask on. One of the things that is discussed while you're at a restaurant or eating with someone is the social distancing with that. So if I am eating with people who I live with, or let's say that I am with, someone that I live with or so forth, or someone that's fully vaccinated, and we're eating together, it's, you're eating, so you don't have your mask on. But if you are eating with other people that are not in your household, there is still some risk there, which is why if you notice with the restaurants, they are limiting the number of people that are at your table. They may have the different partitions up. So because the risk is still there, so it's safer in terms of what you need to do. What I will say is they will give you guidelines on what you can do to decrease your risk, such as wearing your mask when you're not at the table and you're walking around in the restaurant. But because of the nature of it, it does pose some risk. So one of the things that we have to do, which is similar to what everyone else was saying, is that doing things to decrease that risk. And now with the weather getting warmer, if you can meet up with someone and eat in a restaurant, take it to go or eat outside if that restaurant has that option.
Okay, thank you very much. I want to thank all of the panelists for sharing your knowledge, your forthrightedness. You were telling us just like it is. We really appreciate that. And thank you for sharing your links in the chat box, Dr. Shine. And finally, I don't see any other questions in the chat box. If anyone else does, please let me know. I don't see any questions, and I thought we would. And I'm going to ask Christine if you would kindly put the link in the chat box that if someone has a question that they want to email, they can.
There
Yes.
are some questions in the Q&A. I did answer one, and Dr. Conaway answered one of his about, do we know how long the vaccines are effective and will we need to get a booster, which I think Dr. Conaway answered. The second question was, compared to other states, how well is New Jersey, South Jersey in vaccinating its population? And New Jersey actually is one of the top states in shots in arms per population. New Jersey is ranked in the top 5. We tend to go between, I've seen this as low as 3 and then 5. We kind of go back and forth, but New Jersey as a whole is doing very well. And the third question I cannot answer. I'm going to leave this up to the physicians. Is it safe for individuals with G6PD deficiency to get the COVID vaccine?
Well, that's one of those questions where you would take to your physician, but this particular deficiency, when it gets out of control, there are triggers for that. You're getting a vaccine which is, as an mRNA-based vaccine, which we have throughout our body all the time. We're constantly using this particular coding to produce all sorts of protein, including the protein that makes the spike protein against which our body is gaining immunity. So I would say check with your physician, but it's unlikely that deficiency would be a contraindication to getting vaccinated.
That's very good to know. I did not know that. And there was a discussion of that once. Thank you very much for that. Thank you, panelists. Thank you on behalf, all of you, on behalf of the Women's Advisory Council. Thank you all for participating in this. Thank you, American Heart, for participating and helping us pull this together. And again, if you have questions that have not been answered in the Q&A that you think of, you can email them to womenscouncil@co.burlington.nj.us, and we will get an answer for you. And now, to close, I'd like to introduce Commissioner Hynes.
Thank you. I just can't thank all the panelists enough. This was so wonderful. I appreciate your preparedness, your real answers. I think we all get a little confused, but you were very candid and gave us real responses we needed to hear. So thank you so much for all of you. I know this is the busiest time of your careers, and thank you so much for being with us. I have to thank Joanne. Joanne, I just want to be you when I grow up. It's just as easy as that. You are a pro, and the Burlington County Women's Council is so honored to have you on board. As already has been said, this pandemic has affected working women like no other. Statistics show that the number of women who have lost their jobs during the pandemic is greater than all the jobs women gained from the end of 2010 until the beginning of the pandemic. Now, I want you to really think about that statistic. It's staggering. In the last year, more women have lost their jobs than all women gained over the past 10 years. So conversations like this are so important. Many experts have called this the pink recession, which I don't think is something that we've seen enough press about and really dealt with our working women and how we can help them. But it's more about than just job loss. We know that women have gone without health care during this pandemic, which can cause serious health concerns. We know that mental health issues have taken their toll. As a family law attorney, I can absolutely testify that domestic violence is on the rise. It is a real thing, as well as child abuse. And these are issues that we are not talking about that need to be discussed. So just having these conversations is so important. I want to thank everyone, all of our members of our Women's Council. I see all your names over there, making me proud, participating and supporting one another. I'm hopeful that everyone got as much out of this as I did, because it's going to take all of us, all levels of government, nonprofits, the public at large. We all have to work together, but we will get through this. So again, thank you so much on behalf of the Women's Council, Director Hopson and myself. Thank you. Be safe. We always end our conversations with that. Be safe and have a wonderful evening. Thank you.
Thank you, everybody.
Bye-bye, everybody.
Bye-bye. Bye-bye.